Let's begin with the biggest mistake that you do every day, especially if you have chronic spine conditions, of course, especially you, woman after 50 years and older. Today, millions of people are being treated the wrong way for the back pain. They are taking painkillers, anti-inflammatory drugs, muscle relaxant injections, and or use the creams, believing this will solve the problem, but the reality is very different, and those methods only suppress the pain while the disease continues to progress silently. If these treatments truly cure back problems, we will not be living in the time where back pain is one of the leading causes of disability in the modern world. And one of the biggest mistakes people make today is trying to trick themselves using internet advice, random videos, and non-expert recommendation. This is one of the fastest ways to make your condition worse, because without professional guidance, you are only guessing while the disease continues to progress. If you don't know already, over 26 years ago, I did finish medical college in specialty for physical therapy and rehabilitation and spine conditions, and this is my core specialty. For the last 26 years, I have helped cure thousands and thousands of people all around the world with their spine chronic conditions, and I never ever did use any, not single time, chemical injections, some kind of painkillers, any kind of chemical medications, and I was able to cure all of my patients. What is really happening in your body? What is really happening is not healing but the symptom control. And the most common treatments today include NSAIDs such as ibuprofen, diclofenac, naproxen, muscle relaxant, corticosteroid injections, creams, in the more severe cases surgery. And those methods can reduce the pain and inflammation temporarily, but they do not rebuild your spine. They do not restore damaged disc, and they do not correct the long-term degeneration happening in your body. This is why so many people feel better for the short time, but only become worse months and years later. And what you do with your chemical medication and injections, or corticosteroid creams, or massages, or decompression, or maybe you go to your chiropractic that will solve all your problems at once. You all search for the fix, control and fix solution in the short period of time. Of course, everyone sells you this, but on the long period of time, you will become their patients for the next 10, 20 or 30 years. And what is your conditions getting worse? In my 26 years of working with the patient, I have seen major shift. 20 or 30 years ago, serious back problems were mostly seen in people over 50 or 60 years of age. And today I regularly see patients in their 20s or 30s with severe spinal diseases. This is why direct results of modern lifestyle, poor nutrition, lack of movement, chronic stress, and poor sleep slowly destroy the structure of your spine. And over time, discs weaken, joints stiffen, and degenerative change develop. Conditions such as arthritis, disc degeneration, and chronic lower back pain become inevitable. And globally, back pain continues to rise and remains one of the leading causes of disability. So again, if treatment is better than ever, why are more people sicker than ever before? This is one of the most, one of the most question and serious question in the modern world. Why so many people have the spine conditions? Because and we have so good quality modern medicine. Why, my dear viewers? If you have the solution or the answer to your questions, please comment below the video. Why is the mineral number one for your back its needs? And this is going to be calcium. Around 99% of calcium in your body is stored in your bones and the teeth, which makes it essential for the bone strength and the structural stability. Without enough calcium, bones become weaker, more fragile, and more prone to degeneration. And this directly increases the risk of osteoporosis, fractures, and the chronic back pain. Why are you deficient even you eat well? Many people believe they are getting enough calcium, but in reality they are not. And one of the biggest problems in the modern nutrition is going to be processed food containing anti-nutrients such as phytic acid and oxalate acid, which blocks calcium absorption. Even if you consume calcium, your body may not be able to use it. And one of the most serious conditions, besides of course spine conditions for you people after 15 years and older, is going to be your digestive problems. Usually almost 70 to 80% of you already have those digestive problems, and if you have digestive problems, you will not be able to all those minerals and vitamins from your food. You will not able to digest them correctly, and usually you will destroy them with the chemical medication or maybe eating unhealthy food each day. And this is one of the major problems. But before I continue, I really want to for you to remember something. One of the major reasons why you have all those chronic spine conditions is of course going to be structural damage of your spine. This means you have spine degeneration, arthritic changes, and all of these are in the root causes of course is going to be chronic deficiency in minerals and vitamins, and that is why calcium is so important. Even if you consume calcium, your body may not be able to use it. Digestive disorders such as Crohn's disease, ulcerative colitis, or SIBO further reduce absorption. And long-term use of medication, especially corticosteroids, also depletes calcium level. And this creates a hidden deficiency that slowly weakens your spine. And what happens when your calcium level drops? When calcium deficiency continues, the structure of your spines begins to deteriorate. Vertebrae becomes weaker, joints lose stability, and the risk of degeneration increases. And over time, this leads to osteoporosis, osteopenia, and the chronic structural damage. And this is not something that happens overnight. It is a slow process that builds over the years. And as I said at the beginning of the video, those processes may be 20 or 30 years ago begin maybe people that on that time have 50 or 60 years and older. Right now, those spinal chronic conditions begins in your 20s, my dear viewers. Can you imagine this? If you have chronic spine conditions in your 20s or 30s, you will be seeing your doctors and any other specialties that really going to help you with your spine conditions for the next 20, 30, and 40 years. And each year is going to be worse and worse and worse. This is just because you don't cure the root cause. You only take the shortcuts, my dear viewers. And why calcium alone is not enough? One of the biggest mistakes people made is taking calcium alone. And calcium cannot function properly without other nutrients. If you take calcium without a balance, it may not be absorbed correctly and can even accumulate in the wrong places, such as joint and the soft tissue. This is where most people go wrong. Magnesium is second critical mineral for the spine health. It works together with calcium and controls muscle functions, nerve signal, and inflammation. And without magnesium, muscles remain tense, spasm increases, and the pressure of the spine becomes stronger. In the short, this means, my dear viewers, if you have spine chronic conditions, you have arthritic conditions, spine degeneration, especially if you're after 50 years and older, you will need each day and magnesium and calcium for the rest of your life in the food form. This is going to be, of course, the best, or in good quality, unbelievably quality supplements each day. Why are you deficient in magnesium? Modern lifestyle rapidly depletes magnesium, chronic stress, high sugar intake, caffeine, alcohol, and the processed foods are all reduce magnesium levels. In addition, poor soil quality means that even healthy foods contain fewer minerals than before, and this leads to widespread deficiency, especially in people over 50 years. This is my present for you, my dear viewers. This is how I do. This is just a small part what I do with my patients with they have the spine problems. I'm going to recommend you doses and supplements that you really need to take for your spine conditions. What are the best form and dosage? Not all the supplements are equal. For calcium, quality and absorption are critical. And for magnesium, the best forms include magnesium glycinate for the muscle relaxation and sleep, magnesium citrate for digestion, and magnesium malate for the energy and the muscle recovery. Poor quality forms such as magnesium oxide should be avoided due to low absorption. The typical daily intake for magnesium is going to be 400-500 milligrams daily, while calcium intake depends on individual needs, but balance is essential. This is so easy to understand. Of course, I'm going to recommend you the best food in magnesium and calcium that you really need to take, especially after 50 years and older, and they are really going to help you a lot with your spine problems. To support your spine naturally, you need consistent intake of mineral-rich food, and the best calcium sources include sardines, salmons, dairy products such as kefir, cottage cheese, and high-quality cheeses, as well as the plant sources like kale, broccoli, sesame seeds, and the almonds. And for magnesium, the best sources include pumpkin seeds, sunflower seeds, nuts, leafy greens, vegetables, avocados, bananas, and dark chocolate with high cocoa content. However, food alone is often not enough if absorption is impaired. Of course, this will happen in almost 100% for you people, especially after 15 years and older. That's why you will always be worse and worse and worse. This is not something like 99% sure. This is 100% sure. But 100% people, almost 100% people don't believe in nutrition, natural remedies, minerals and vitamins. And this is we are right now, my dear viewers. Why random advice will not fix your back? If you want to improve your back condition, you must understand that it's not a simple problem. Taking one supplement or following random advice will not solve it. Supporting your spine requires a structural approach that includes proper nutrition, targeted supplementation, and professional therapy. And the biggest mistake you can make is trying to combine random information and treat yourself without a clear plan. And what I see after 26 years of practice, I see the same pattern again and again and again. And people come after years of failed treatment. They have taken medication, received injection, tried different therapies, and follow advice from the internet, and almost always their condition is worse before. And this is where you call my office. On the most chronic, critical stages. If you call my office in those beginnings of your problems, I will fix your problems in no time for the rest of your life. And you always come to my office and you try and seek my professional help after you fail for almost 20, 30, 40 different kind of treatment, especially with your doctors, and then you believe in other people that really try convince you that their approach is the best. If this all is not true, you can see right now it's almost 800 million people worldwide with the chronic spine condition. In simply the words, this means people after 50 years and older had almost 60 to 70% spine conditions. Why is that, my dear viewers? If we perfectly treat our spinal conditions. 30 years ago, there was almost 100% less people with the chronic spine condition, and each year is going to be worse. You just take this approach, as I said before, for the years, 100% you will have unbelievably spine temporary condition. For the last 26 years, I'm helping patients all around the world to overcome chronic conditions, and my core specialty is going to be help you overcome spine chronic conditions like herniated discs, sciatica, and similar kind of degenerative disease of the spine. Also, my core specialty is going to help you overcome knee osteoarthritis, hip osteoarthritis, rheumatoid arthritis, osteoporosis, and similar kind of joint problems. And this is something I work extensively for almost 30 years. And here's what most people don't realize. Those conditions are often treated for the years with pain medications, injections and surgeries, but the root cause is almost never addressed. That's why the pain keeps returning and conditions slowly getting worse. And my MarioLab protocols are completely different. They are rooted in the modern medicine like physical therapy and rehabilitations, and most important part is going to be nutrition and natural remedies. And those my programs really can help you. And if you, for any country in the world, you can call my MarioLab Center in Zagreb, Croatia on the phone number +385 989179 200. My programs are created 100% individualized based on conditions, medical findings and long-term goals. And you can come to my office, you can call my private phone consultations. I really believe I can help you. If you want to learn a lot more about how you can help yourself with best vitamins for your spine conditions, watch my video right here. Thank you for following my videos. See you in the next video. Bye bye.